And we're speaking on Jorge Prado, so let's get to our SMX medical update and bring on Dr. Joe McGinley. So Jorge, super forthcoming, did an interview right after he was hurt, saying he dislocated his shoulder. So with that information, what runs through your mind when you hear that?
Yeah, these guys are amazing. He's out there on the track, gets injured, and then still takes the time to update the fans. I mean, how much more access and better does that get? Yeah, it's unfortunate. We talked about it a little bit with the Achilles that, he was sort of off rhythm coming up to that turn, and he reached out to grab the net to catch himself, and his shoulder popped out. I'm sure he wasn't expecting that type of force, and that's a lot of time where these injuries occur is when you're not expecting it. Good news is he mentioned it popped right back in within 30 seconds of that popping out. That's a great sign. And the fact that he was doing an interview, right after the injury, also a great sign. So it was good to see all that right after this type of injury.
Yeah, so if it goes back in, how bad is it going forward, or is that actually hard to know that quickly?
Yeah, he mentioned he's getting an MRI. That's exactly what he needs to determine the extent of that injury. The fact that it popped back in quickly and he was in relatively not in discomfort during that interview means there's probably minimal damage. But you really won't know to the MRI. Structures that can get damaged, there's ligaments down the lower part of the joint. This is the ball and socket joint of the shoulder. Also, you can tear your labrum. Rarely you can damage nerves, you can damage muscle. It didn't seem like he was in distress during that interview, so also unlikely. But the MRI is going to be the definitive telltale as far as what's happening in that shoulder.
And is the risk here the chance of it's back in, but the chance of re-injuring it, having it come back out, is that what you're trying to keep an eye on at this point?
A lot of times for our athletes that come to see us, we'll treat with platelet-rich plasma or PRP. That helps to accelerate that healing process. More long-term, you want to strengthen the muscles around the shoulder to keep that shoulder stable. Once you have a shoulder dislocation, you are prone to it in the future. That's one of the risk factors for future dislocation is a prior dislocation.